not depression, I don't want to say depression, but lost. I was lost, which is normal. Dentistry, it's overly saturated. وهذا كجي بي انت it's a loop. والله in the clinic it's a loop. Fourth year they don't know anything. They don't know.
Hello, everyone, and welcome to the fourth episode of our BS Talks podcast. Today is a very special episode because we are joined by someone very special. I'll pass it on. We're going to be sharing a mic, so we're going to be passing it back and forth. Here you go.
We've spoken about our guest multiple times now. We gave it hints here and there, but finally it is the time to have our interview with him. We've told you before that he has recently graduated. He has recently joined a master's program. His personality is beyond just a university friend. He's someone who has helped us become better people, have better personalities, gave us clinical advice, and we thought that all this advice that he's given us, it's not enough for us to have it all on our own. We'd like to share the experience we've had with him. So without further ado, please welcome
Musa Deher.
السلام عليكم.
وعليكم السلام.
أهلا وسهلا.
هاي ال significant item اللي حكتوا لي عنه.
Put it on the table.
بس عشان الاسم. Yes, I don't know. You guys fix it.
It looks good. It's fine.
Thank you.
It's just a little bit in the coffee.
هاي ثاني مرة على فكرة. That's the second time.
This coffee is what's it called? Lavazza espresso. It's a new one. I bought it the other day. I'll put a picture here because I forgot its name.
Right above my head. That's where all the pictures are going to be?
Where will the pictures be now? Somewhere here.
Okay. Yeah, no, this is a great opportunity, I think, not just for us, but for everyone to experience, because you have some very important things to say. You've been through university, and all the struggles that we're going through, you have been through. So some insight on everything would be amazing, and we're going to be asking questions. Hopefully we can get some very rewarding answers for us and the audience.
إن شاء الله. أول شيء, thank you guys for the nice introduction, and thank you guys for having me. صراحة it's an honor يعني to be here. وإن شاء الله يعني I was supporting this idea, I think, from the beginning. It's a good thing. يعني go for it. يعني stick to it and go for it. It has its ups and downs, but
بصراحة نحن يعني أكثر من مرة قعدنا شهير and I to discuss إنه مين أحسن واحد يكون أول شخص يجي على هالبودكاست. we made a decision immediately. First person that came to mind is you.
إن شاء الله.
يعني hopefully this episode حيكون مفيد و you're gonna enjoy it and you're gonna learn a lot from it. So to start us off, Shahir.
And just so everyone knows, none of this is scripted. Everything is all natural. He doesn't know the questions either that we're going to be asking. None of it. It's all one shot. On the spot.
Yeah, I just asked this. It is one shot?
Yes, one shot. One shot. So let's start with our first question.
Okay. Bismillah.
You finished 5 years of university.
Yes, I did.
Let's start with how your university experience was. From beginning to end, what you struggled through, what you liked, what challenges you faced, anything that was easy for you, what made you, the person you are today.
بسم الله الرحمن الرحيم. أول شيء صراحة 5 years it's a long time. أول شيء it's a very long time. صراحة it went good. It went well. I wouldn't say it was bad. I wouldn't say I would not want to do it again. No. صراحة it was good. It was great. It was perfect. Of course challenges come يعني throughout. وين أنت كنت وين ما كنت challenges will happen. صراحة what I faced or what يعني كان أكتر شيء صعب assignments. I hate writing. I hate writings. I can't write. So assignments يعني was one of the struggles. Exams و tests, class tests for me يعني they were fine. I was up to date. I used to attend lectures. Studying يعني it wasn't too much صراحة, بس الحمد لله it went well يعني it was nice صراحة. وصراحة جامعتنا أو Gulf Medical University يعني it's a good place. It's a good community place. والله it's a good يعني vibes they're good.
طب هلا احنا في talking about the medical field. أنا هلا 2024-25 do you still recommend, is it still worth it هدول ال 5+ year career؟ يعني you're talking about some people who are going in deeper مثلا
صراحة 100%
10-12 years.
100%. أنا مع الناس. أنا من الناس اللي if you have a goal ولا if you have a pathway ولا you have like a vision صراحة go for it. ما في إشي اسمه والله إنه هاي بالأول والأخير العلم عم بتطور, medicine is improving, كل شيء عم بتطور. يعني what we had now it's gonna happen later, when what they had before happened.
Yeah.
So لا, yes, go for it if you have a medical pathway, ولا انت if you have a medical vision, yeah, let's go for it. Dentistry, medical, pharmacy, whatever, go for it, why not.
لأنه كمان بعدين the most important debate about the medical field is you're paying أرقام huge amounts of money for you to end up getting paid. يعني generally speaking القاعدة العامة بتقول لك on par with some other majors.
100%. بس شوف بالأول والأخير هلا إذا أنت بتحكي عن ال UAE أو الهاي, yeah, it's oversaturated. مثلا موضوع الدنتسري it's overly saturated. وهذا كجي بيز. أنت ممكن مثلا تتخصص, ممكن تعمل إشي تاني, ممكن تطلع لبرا. يعني أنا ضد إنه أنا أخلي عقلي ملزوم في مكان واحد, limited to one place. يعني صراحة I don't live here and you guys know that. I live here alone. I came here, I'm gonna study, I'm gonna do whatever. And then I'm gonna move outside. Maybe, hopefully, inshallah. Maybe outside, يعني I'm gonna be paid more هون. لا, I'm gonna stay here. Don't stay limited in your circle.
Yeah.
يعني
صح.
widen your high.
And that's why we're talking about this now. Graduation, so we can focus on the master's pathway. Your item today is your hat.
Yes.
What's it called?
It's a, what is it called? Graduation hat?
Graduation hat.
Cap,
So
hat, I don't
tell
know.
us about it. How was your graduation? We'll have some pictures for you from Musa. يعني tell us their experience كله كيف كان. How was it? يعني memories, anything you want to share. احكي لنا عن الطاقية
شوف,
بشكل عام.
I'm gonna be honest. يعني Shahir just texted me like 15 minutes ago telling me that I have to bring something significant. And then, I don't know, يعني the first thing I thought of is the graduation cap, hat, whatever. صراحة, it's a life-changing moment, والله. It is a life-changing moment. And it's worth every single thing you do in these 5 years. Subhanallah, anything you do after this counts. Any decision you make counts for you. It's a good feeling. يعني صراحة I can't explain. ما بقدر أشرح شعوري بهداك اليوم. بقدر أشرح يعني حتى شعور أهلي ونظرتهم إلي, my family, how they looked at me, when I saw their smile, when I was sitting there, when they called my name.
موسى عماد ظاهر.
Preparation, wearing the suits, wearing the gown, going there, صراحة لا, it's a different feeling صراحة. وإن شاء الله يا رب عقبالكم وتفرحوا وتنبسطوا وتصيروا أحسن مني إن شاء الله, والبيحضرونا إن شاء الله يا رب, أي واحد بستناها. أنا I believe it's a matter of time. Everyone lives in their own time lapse or timelining, I don't know, whatever. أنا English يعني شهير بليز, يعني كل واحد بيمشي بخطاه, ما في حدا متأخر, ما في حدا سابق حدا, ما في حدا. أنت صراع مع نفسك مش صراع مع حدا. امشي وتوكل و it's a matter of time إن شاء الله وتصير هون.
من يعني شو أول إشي فكرت فيه؟ إيش أول إشي خطر على بالك ولما سمعت اسمك they're calling your name موسى؟ فإيش أول إشي فكرت فيه؟ هل أهلك؟ هل فكرت إنه now real life starts؟ يعني what was going through your head؟ أنا هيك بقعد بفكر إني أنا لما أتخرج هلا إن شاء الله آخر السنة
إن شاء الله يا رب.
إيش بدي إيش الإحساسات, مشاعر, emotions, أفكار. oh this is now responsibility, now adulthood, now كذا. فيعني
شوف, صراحة when it first, يعني when they first called my name موسى ظاهر, I blacked out. والله I blacked out. I smiled يعني شوي, حتى الفيديو تاعي وأنا بمشي I'm walking هون ما أعرف مكان. I blacked out صراحة. I couldn't think of anything. والله يعني أنت the spot, the moment, you can't, even if you prepared something to do, you will forget it. The spot, you will forget it صراحة. That's what happened with me. I smiled ومن جواتي بحكي الحمد لله الحمد لله الحمد لله. After I got my certificate, I walked يعني forward. صراحة I looked at my family. أنت أول إشي دائما الواحد برجع للأوريجين تاعه, لأصله, لهاي. صراحة I looked at my family, I saw my dad and mom. يعني I teared up شوي, بس I tried to hide it. يعني في emotional شوي. الemotions بهاليوم بيكونوا overload. Yeah, I think that's it.
No, I think that's what makes it all worth it in the end of the 5 years,
Yes.
is that you get to walk up on stage in front of your family and show them that, hey, I did it.
Yes, exactly.
You know?
And in front of everyone. وصراحة يعني everything you do in these 5 years, challenges, الوقت, التعب, staying overnight, studying, passes. والله with time خلاص it goes.
so moving on from that topic, نحن we graduated خلاص, we became doctors. Now
Alhamdulillah.
next step, ليش why did you decide هي كتير مهمة why did you decide to do your masters immediately في ناس بيقول لك no I'd rather work a few years gain some experience and then do masters because the pathways or like the decisions you have to make or the options you have in dentistry are huge
صح.
وعندك مليون طريقة و I can do this first و I do that بس if I do this فشو أنت برأيك why؟
شوف أنا ححكي صراحة about my own experience about what I faced لأنه بحس in dentistry it's as you said يعني it's a very wide range. I could say something وبعدين شهير doesn't agree because he's moving back to Canada and he has his own lifestyle and his own goals and his own high. هلا for me صراحة it was one of the hardest thing يعني it was one of the hardest decisions إنه أنا I study masters or work for my special or actually work. يعني هون كان عندي اختيار صعب. بالأول والأخير للأمانة والله خليتها على الله. حكيت إيش ما يصير أنا حتوكل على الله. لما خلصت الباتشلرز أنا إنسان okay I have my goal I have my vision but I'm focused طبعا I'm not saying I'm not focused بس أنا I focus on the next step. I can't be worrying about what am I gonna have in my clinic how the interior design of my clinic is gonna be on my يعني هاي. لا for now أنا my plan is I graduated صح. What's the next plan? Internship for us at least in internship in dentistry. إنه الinternship where am I gonna do my internship. صراحة for me أنا شايف جامعتنا والبروجرام الانترنشيب تاع جامعتنا جدا ممتاز. الدكاترة thank you لأي واحد بتطلع أي واحد بحضر هاي الابيسود thank you doctors everyone والله each one and everyone thank you very much من الكبير للصغير they helped us a lot and they helped me a lot at least they helped me a lot. Now in March April after Ramadan بتذكر last year I had this 1 month of not depression I don't want to say depression but I was lost which is normal والله العظيم it's normal. What am I gonna do? Am I gonna work? Am I not gonna work? Am I gonna do my masters? What am I gonna do masters in? صراحة with time, with effort, with working in clinic, I chose endo. I talked to my family and they decided that yeah, go for it. Like خلاص finish everything as soon as possible and then work. Plus إنه I can work while doing my masters. يعني إن شاء الله I'm working on my exam now, MOH exam. إن شاء الله hopefully يا رب أخلصه and then probably ألاقي شغل إن شاء الله hopefully if I find work I'm gonna work and do my masters إن شاء الله. it's a 2-in-1 way يعني إن شاء الله depending on my goals and vision it's a 2-in-1 way يعني I'm gonna be doing my masters as well as working so I'm getting both at the same time. Why not?
Yeah, no, that's really good. I feel like it also depends on where you are because I mean for me I've planned to not specialize. I mean for now.
Yeah.
Because I plan to just go back, get some experience, start working because I feel like I'm still lost, you know. I don't know which specialty I want to go in.
Yeah.
I'm thinking about ortho, but also I don't think I would want to spend that couple of years just right after doing ortho, you know.
Exactly. Yeah. أنا يعني in Canada what I heard صراحة from my colleagues you need 2 years of
you do, yeah.
Yeah, so it's just go there. For example زي ما بحكي ما بقدر أنصح لأنه كل واحد عنده هدف وكل واحد عنده رؤيته للموضوع. يعني for me مثلا no I would actually finish everything and then leave UAE and then move back to Qatar. وأهلي هناك خلاص I would move back to Qatar. I have my license. I would just work like okay I gained experience. I did masters. Now I'm a specialist there. يعني إن شاء الله يا رب إن شاء الله مع الوقت إن شاء الله I'm gonna be a specialist there. خلاص one shot.
That's it. Why endo?
Why endo? Yeah. I'm not creepy. والله I'm not creepy. لأنه everyone why endo? Why endo?
Yeah, it is creepy because
no I'm not creepy. Look I'm gonna tell you. You're gonna be creepy if you liked endo in 4th year or in 3rd year when you first start working endo because I remember myself doing my first case in endo in 4th year. Wallah, I didn't see a thing. I didn't see the tooth. I didn't see caries. I didn't see orifice. I don't know what they're talking about. Bulb chamber, orifice, move more, expand more. I don't want to go into medical terms عشان ما they don't lose interest. But it's normal. Endo it's a hard topic. Practically, theoretically maybe it's easy. It's fun. It's interesting. But practically it's a hard topic because you're dealing with very small canals. That's the diameter of 1 mm, literally. صراحة with time, with experience, in my internship I did so much endo. صراحة I did so much endo. Molars, premolars, anteriors. Mainly I was focused on upper molars. I don't know why I like doing upper molars.
Oh, that's even creepier, you know?
No.
I swear.
Believe me. When you go into internship, believe me, you're gonna find upper molars that are easier than lower molars.
Really?
Actually, in lower molars, it's very hard to see the mesial canals. You're not gonna see them. You're just gonna imagine that they're there. But in upper molars, no, you actually can see them. But look, with the endo صراحة, it's a top, it's a يعني speciality where إنه once you do more, you're gonna like it more. Once you're gonna grow passion to it. You're not gonna just like it out of nowhere. And you can't expect like endo. يعني the tooth, like for example, it's an upper central. You go like, oh, I'm gonna finish it in one visit, and it takes you 4 or 5 visits because it has a simple complication, for example. So it's nice.
It's different, yeah. But were you always like were you always good at endo, and that's why you were like, oh, I want to do endo?
No, I was bad in endo. Not bad. I was average. يعني صراحة in 4th year زي ما 3rd year هلا بالكلينيك زي ما 4th year هلا بالكلينيكس, I was just like them. صراحة it's a loop. والله in the clinic it's a loop. 4th year they don't know anything. They don't know weed. صراحة. Yeah. 5th year then you're gonna move to Sharjah. You're gonna be stuck in a closed room where you're gonna have to actually work like you guys are.
Yeah.
You're gonna learn a bit, and then you're gonna move on, and then an internship I think practically where you're gonna learn the most. ليش؟ لأنه خلاص you don't have anything theory. You don't have assignments, tests, exams. You're just focused on clinic. خلاص, you go, you work, you do what you do. ما بتعرف هذا الاشي, please doctor help me. They come help you, they explain it. خلاص, okay, now you know it. Next time you're gonna do something else. Yeah, why endo? I was not good in endo. بالعكس, I wanted to do surgery in the beginning.
Yeah.
I think 80% of doctors, they want to do surgery. And then they change. صراحة for me, surgery, I like it. It's me. I love surgery. I used to do so many extractions, surgical, normal extractions, wisdom tooth, not wisdom tooth. But for me, no. Endo is it's more challenging. It's more, يعني, it's more me. I don't know. I like details. You know?
Okay, yeah, very nice.
Yeah, so why endo? Yeah, that's why. I don't know. It just came.
Yeah, fair. But at what point in those 5 years did you decide, hey, endo, I'm going to go for endo?
And I will tell you when.
Okay.
When I got my offer letter.
After graduating?
Yeah. When I got my offer letter. No, not even after graduating. After doing internship, after applying, after doing everything they want. When I got my offer letter, I was like, okay, endo is good. I felt good.
Yeah.
Actually. Because look, when I applied to endo, أصلاً the story of me applying to masters, يعني ما بعرف كيف. والله العظيم يا جماعة ما بعرف كيف. عشان هيك دائما بحكي لا تتوتر ولا تفكر لقدام don't plan يعني too much. Just go with the flow. خلاص. وربك بيسرها. أنا لما أجيت أسجل إندو حكوا لي أول إشي 4 seats للإندو ماسترز بجامعتنا. There are only 4 seats. I asked من February, they were like it's taken. خلاص. Indo is done. I was like خلاص okay. And then I woke up one day on Monday. On Monday I was like let me go ask about Indo. Why not? I asked the program director صراحة. الفضل لله طبعا منه. حكى لي we have one spot. في واحد طلع من البروجرام. أنت حاول قدمت. On Monday I applied on Monday.
Yeah.
On Wednesday I got my offer letter, and then on Friday I traveled to my parents. I was like
MashaAllah.
yeah والله it happened هيك. I don't know how. On Friday I went to my parents. I was like I need to talk to you guys. مش عارف شو. We had a family meeting. I was like I'm gonna be doing this. What do you guys think?
Yeah.
And they were like, what? You got your high? I was like, yeah, this is my offer letter and this is me, and I came to discuss this with you guys. And then after they agreed, I was like, okay, this is it's for me. And it's for me. So I don't know, it just came. Yeah, it just came.
That's so nice. That's so exciting. I can't wait to like have that moment where I get to go up to my family and be like, hey, like, you know.
Yeah. صراحة it's a big step, but I took the risks and I went to my family يعني. Alhamdulillah.
Yeah. How far are you into your master's program now?
I'm in my first semester yet.
First semester.
Yeah, first semester. The program is 3 years.
Okay.
So I'm gonna be having 6 semesters. So I'm gonna be spending 3 more years in Gulf Medical University.
Fair. So it hasn't been much time. You're still in your first semester, but how's that first semester going?
صراحة it's going great. It's going perfect. Yeah. So شوف يعني in the beginning I was busy.
Yeah.
Like it was all new. Like I had a gap year from theory part or theoretical part where I didn't have any exams. I didn't do any assignment. I didn't study blah 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 in the internship program. And then masters. Within a week, you have assignments, you have midterms, you have article discussions, you have clinical discussions. Every week there is an article that you need to read, that you need to discuss, that you need to present. صراحة I'm done now. الحمد لله يعني هالفترة خلصتها. You guys wanted me from last week. I'm sorry guys. تأخرت عليكم. But I had a lot of things to do. صراحة it's going great. I like it. And the feeling, like you're an endo master or whatever master you're doing, the specialty, you're a specialist now, you're a doctor now, you're a real doctor. صراحة it counts for something. يعني even dealing with patients, it changes. Like the way you deal with patients, it's completely different صراحة. Yeah, I think it's going great.
ما في يعني بس هي the question was why إنه يعني أنت you said you waited for the last second to choose endo يعني هلا فهو that's the advice we're trying to give students يعني إنه هي كلها حتى يصير رب العالمين ولا تاكل همها كتير
شوف هي حلو. it's I'm gonna be talking in Arabic.
No, it's totally fine. Yeah, go ahead.
شوفوا والله جماعة ما بحكي ما تخطط، ما بحكي ما تحط أهداف، ما بحكي ما أنت ما يكون عندك فكرة لقدام إيش بدك تعمل. بالعكس خطط وحط أهداف، بس ما تخلي أهدافك اللي لقدام بعد خطوتين أو ثلاثة تأثر على الهدف الأول اللي أنت برئيسي هلأ. يعني كباتشلر ديجري أنت هلأ first second third fourth fifth year، أنت بسمستر 1 بسمستر 1 بسمستر 2 بسمستر 6، أنت هدفك الصغير إنه أنت تخلص الميد تيرمز وتخلص الامتحانات وتدرس وتتعلم إيش السمستر هذا بده منك تتعلمه. الهدفك الأكبر إنك تتخرج. بعد التخرج أنت عندك internship سنة كاملة. يعني أنا بحكي على الإمارات والخليج وهاي يعني probably most of the countries majority إنه بدهم before you apply to masters بدهم internship year. فالinternship year هاي 1 year clinical أنت تشتغل وتفكر you go deep إنه أنت إيش بدك تعمل. أنا بحكي لك أنا من الناس اللي كان بدي surgery طول عمري and then I did endo, I did operative, I did surgery, I did مش عارف شو. والله على ظروفي وعلى الأشياء اللي أنا بدي إياها لا والله لاحظت إنه اندو أنسب لي. قدمت اندو، سجلت اندو، الحمد لله وتيسير رب العالمين أول وآخرا يا أخي. وكل شيء يعني كل شيء سبحان الله. بدي أحكي جملة كل شيء والله أي شيء وصلت له، أي شيء أنت وصلتوا له، أي شيء أنت بمكانك هون عم تحضرني، هذا توفيق من رب العالمين وليس منك، هذا بفضل رب العالمين عليك. فدائما الحمد والثناء يعني الحمد لله لك يا رب. اشتغل سوي اعمل اللي عليك والباقي رب العالمين. حيطلع لك ما حيطلع لك اتس نوت meant to be يعني خلص.
يعني حتى موسى نحن وين سبتمبر يعني لو يعني he put himself in a situation انه خلص انا بدي عنده no matter what وكان عنده internship ما كنا نشوفه بس خلص حط براسه انه I wanna do this because this is what I want مع انه كان مختفي بس الحمد لله.
والله الحمد لله اجت شهر ونص والله I disappeared صراحة.
No, I totally agree with everything you just said. Huh? Everything. I totally agree.
طيب, can we talk about coffee? And you guys always talk about
okay,
coffee.
let's
I want to try coffee.
Yeah,
you guys been drinking?
Try it. It's so good though. Still, I'm making like weird faces every time I take a sip because it's so good.
Actually,
I feel like they're gonna look at me and be like, "This guy thinks it's gross," but no, it's so good.
Wow.
Yeah.
No, that's good. Good. Yeah. Next topic.
Yeah, you keep passing the mic to me. It's your
I know, but like we should share and talk about it, you know? Okay. But we can
worried about my card.
تعرف شو التشالنج الكبير اللي صار؟ شو التشالنج الكبير اللي صار؟ الآيلتس. I had to do IELTS again after 6 years. I've done my IELTS in 2017 and 2018 and they've asked it again for masters. And it was so annoying. I want to know why is there such an exam? Why?
What do you mean it's for English?
Yeah, why do you want to know?
It's the global language. Like,
yeah, okay, but why is there an exam that
I'm already in my uni and I already gave them my IELTS. Why should I do it again in the same uni for my
Because what if you lost that, you know?
I lost my English?
No.
Yeah.
Okay. You lose your English. Okay, يعني but يعني why would English like decide my career path in dentistry?
Because you should know English.
Come on. Okay, if an Arabic patient came up to me.
Yeah.
I would talk to them in Arabic. I wouldn't talk to them.
What if an English patient comes up to you?
I will talk to them like normally. I wouldn't like عادي. You have pain? Yeah, you need root canal treatment. Done. Yeah. By the way, I got 8 in my IELTS speaking.
Did you actually?
Yeah, I
You know what I got? I think I got 7.5.
Bro, you're fake Canadian. Well, what can I say? Daffodils.
So
Daffodils is the way. Wallah, daffodils.
Okay, well, now we're gonna move on to Q&A. The Q&A that we're gonna, so you don't know, but so the Q&A is like, we're gonna be asking questions about like your field, but also like, you know, like some questions outside, you know?
Okay.
So we'll do one question each. I'll do a question, respond and everything, and then he'll do the next question.
Inshallah, yalla, let's go.
Inshallah. So let me start with the first question.
Yeah.
So this is more for students that are interested in endo or they have some doubts or anything like that as well, okay? Because me, honestly, I'm in my 5th year, and I've only had one root canal that's ever been like perfect. You know, reach the working length with the obturation and everything. Otherwise, it's either been too short, either been too long. Cause I'm not good at endo.
See, no, it's not that you're not good. No, don't say that. You're good at endo, but that's endo. That's why I'm saying it's hard. It's not an easy thing to do. Practically, it's not easy. It's fine.
So
it's
hard,
fine. Yeah, it's fine. With time, with practice, you're gonna have overestimation. You're gonna have underestimation. You're gonna have so many things. You're gonna break a file. You're gonna do a ledge. You're gonna create a perforation. So what? You learn. You learn, and then you move on. But that's endo. So you're good.
Okay.
You're good.
Thank you.
I was in this position one day. 2 years ago, I was in this position.
Yeah. So I'll be learning as well with these questions. Yeah.
Inshallah.
Thank you. Okay. So, what factors influence the success rate of root canals?
What factors influence the success rate of root canals? صراحة case selection. First thing.
For sure, 100%.
Case selection. Okay, so for students that's in 4th year, I don't think it's fair enough for them to work on molars or upper 7s or upper 6 or even upper 5. Upper 5 is acceptable actually. So case selection is number 1. Why? Because as an undergrad, just go to low difficulty cases. As an intern, go to medium difficulty cases. As an specialist or master's program, you take hard cases. Yeah, for example, يعني أنا مثلا in my master's program, in my first semester, I'm doing endo. I'm only allowed to work on anteriors.
What?
Yes.
Wow.
Yeah, because like صراحة يعني البروجرام دايركتور والدكتور صراحة ما شاء الله عليهم. They think it's like everything is step by step. So first of all, first semester you're gonna have only 2-3 months where you're gonna actually work on anteriors.
Yeah.
So I think what factors أهم إشي من factors that to elevate the success rate of root canal, case selection. Know your limitations. Know what you're good at. First of all. Second of all, of course, isolation. Isolation يا جماعة والله isolation من أهم الأشياء. I just read an article about isolation.
Really?
Yeah, 2 weeks ago. Guys, isolation increases your success rate up to 96-97%.
What is it without isolation? I mean, like an estimate. 20?
No, 90. I think it was 90%. But like the article itself had its limitations, and the study was it was done on million people. Yeah. And it took place for I don't know how many years, 6 years, from 2005 till 2011. So it's a big article. So usually the success rate is high, but case selection, isolation. 2, there's so many things. Like for example, the irrigation you use, what type of instruments you use, the working length, the apex locator, the X-ray, the quality of the X-rays you take, the shafts, medial, straight, distal shaft, all of this. But for now, as an undergrad or as an intern, case selection, isolation, I think هدول أهم شيء that you can decide.
We talked about the success rate of the root canal treatment. Let's take a step back again. Why do students hate endo?
Why do students? Because I will tell you why. And I will tell you from my own experience صراحة, and from what I have witnessed in clinic, they don't see what the doctors they're talking about. يعني for example, in my first endo, second, third, fourth, and 4th year and 5th year, the doctor's telling me, Musa, look, here's the canal, and he just puts the file right in. The file is here, needle. It's a small needle where you. What are you talking about? What are you seeing that I can't see? And then I go inside, and then in some cases where you have to use indirect vision, where you have to use a mirror, and it's even harder. So I think why do they hate endo? Because they don't understand endo. And I feel
like endo is one of the most important specialties to know the theory behind it. Yes. Instrument, you know numbers, you need to know anatomy, you need to know what am I doing and how to prevent it. If I don't know all this, I'm lost.
Exactly. صراحة anatomy is very important صراحة for all the teeth. يعني every single teeth, subhanallah, every single teeth has its own anatomical findings, anatomical shapes, anatomical variations as well. So it's if you know all of this, if you studied anatomy well, and if you know every variation of every tooth, and a patient came up to you and he said, look, I have a pain in my central incisor, for example. خلاص, you have an idea what you're gonna face, and then you're gonna do it.
No, that's a really good point. I 5 years in, I still hate endo.
Wait for internship.
Okay.
Wallah. In your internship, I'm gonna be in second year. Yeah, I'm gonna be in second year of my masters. Wallah, whenever you have endo, I'm gonna be with you.
I'm not gonna be here for internship. Yeah.
Actually?
Yeah.
Then
I'm leaving as soon as I'm done.
Yeah, that's good. Then hate endo عادي.
Okay.
الله يستر أنا خايف من هالورق.
Sorry?
I'm scared. I'm scared from this paper.
Oh, no, it's okay. It's okay.
I see so many.
No, yeah, it scribbles. My handwriting's really bad. Even if I showed you, I don't think you could read it.
Yeah.
Okay. What are some common challenges that you face in root canals and how to get past them? And if you want, I can give you some like challenges I faced and you can tell me like how I would have gotten past them.
لا, it's a very good topic لأنه I have a patient that's coming today. I've given an appointment at 3. صراحة it's one of the hardest cases I have dealt with till now. So it's a lower 5, it's a lower premolar. Supposedly it's easy. I promised the patient that I would finish it hopefully in 1 day. Because it's a lower premolar and I've finished my requirements and I usually do single visits for all the cases that I have. Alhamdulillah. And then this case, there is one orifice, one opening for the roots, one orifice for the pulp, the vascularization. For the vascular area or the nerves and tissues. Look, and there is one trunk that's 13 mm, and then this trunk splits into 2 small roots. You know what I mean? So it's a one root. Okay.
But then
the pulp inside it splits into 2 small pulps. Pulps. You know what I mean?
Wow.
Yeah. Variation here.
Yes.
So this is one of the hardest cases or the challenges.
You have an X-ray, we can put it here, X-ray of the patient if you have it.
Yeah, here.
There you go.
So how are you going to be working past that? I mean, you don't have to get into details, but I mean, just like a brief like.
صراحة, today's the 3rd visit.
Yeah.
Other than that, it's a very tight canals. I couldn't get file 8 or 6 into the working
No
left.
way.
Yeah, I couldn't. صراحة, with the help of the doctors, I could do that. صراحة, I used irrigation and manual filing, and I used microscope. There's a microscope for endo. Here's a picture if you want. of me working with the microscope. Yeah,
he knows.
No, but the microscope, like صراحة I'm very proud of myself, like using the microscope. Like it was my first time using it and like seeing inside the canal. صراحة it's high. So with the microscope, with the advanced technologies, it helped, wallah.
Yeah.
Inshallah, hopefully today, if I obturated, and I don't know when are you guys gonna post this episode, hopefully we'll have the obturation, if it was good. It's gonna be here on my face.
Maybe then,
Yeah, but I doubt it, but inshallah, it will go good, inshallah.
طيب, حكينا عن why we hate it, what are the complications. هلا, the nice part, what is the most satisfying? أنا بالنسبة إلي, the most satisfying part is take an IOPA بالنهاية and just see the cataperca flush on the apex. Ya Allah. And that's why I like endo so much.
Can I tell you something? If the cataperca flushes on the radiographic apex, that's mean you over-instrumented.
There you go. Now it's not even satisfying.
Yeah.
Stop. No.
If it flushes the anatomical radiographical apex, it means it's over-instrumented.
So it should be a little short.
Like, okay, now ideally it should be, like 0 to 2 mm is good for the high. But it's good. Look, I don't want to say that over-instrumentation is something bad. عادي, it happens. 0.5 is acceptable, normal. If it flushes, that means it's only 0.5. Maybe I'm not right about this or high, but no, يعني you're good. والله عادي.
Like,
But what is the most satisfying part? ما قلت لنا.
I will tell you. Do you have a question?
Ask.
I'll ask after.
Okay.
Yeah.
صراحة, the most satisfying part is when you get out the pulp. When you actually, like when you do your access, you see your orifices, the canals, I don't want to say, opening of the pulp, and you pull out the pulp and you see it. You actually see
I've never seen it. Like when I got a root canal done. Yeah, picture right here. But okay, I've had one root canal done ever for my tooth, and it was, I went to this.
Well, the patient was in pain?
No, it was on me.
Oh.
I went to a student here, and they made it. It was supposed to be OPD, but they went too deep, and I was trying to save money, so I went to them. They were in 3rd year at the time, and after that, I had to get a root canal. Hopefully, they're not watching. But after that, I had to get a root canal done, and when she put the file in and she suctioned, I saw blood just gushing into the
it's blood vessels. There is a
Yeah.
blood vessel and nerves and veins inside every tooth.
But whenever I've never seen that, like outside of picture there. Okay, so what I was gonna say is that look, 5 years in and we still don't know. Why are you crying?
So from the laughing.
Oh. Yeah. So in our 5 years, we've always thought it should reach flush, and even when we're working in the clinics now, doctors are like, hey, you need to go a little deeper, even though it's like this much off. They're like, 0.5 mm, go deeper. You know.
Look, I'll tell you something about endo or about like doing X-rays and everything. صراحة يعني you can't depend 100% on X-rays, and you can't depend 100% on the apex locator. You can't depend 100% on your clinical experience. So it all like gather up and give you the perfect outcome. For example, so if it flushes the radiographic apex, that doesn't mean it's bad. That doesn't mean you've done something wrong. That doesn't mean you're gonna like create pain for the patient or anything. No, okay, but for this level of learning and experience, okay, you should do that. Even us now, sometimes we have to do like not. I don't want to give wrong information, because it depends. Like, guys, in practical, for the people who are joining practicals or clinics, every case has its own specially
Of course.
special things.
It's unique.
Every
case is unique,
every case is unique. Like, you have to deal with it depending on the case, depending on the patient, depending on the anatomy, depending on the tooth, depending on so many factors. So that doesn't mean if you flush the radiographic apex, that means it's not good or it's not perfect, or that means that you've obturated perfectly. بالأول والأخير, if we want to know that we have obturated perfectly well, we have to extract the tooth and see where is the apical constrictor.
Yeah.
Like, I don't want to go into anatomy, but you guys understand. So it's good. Like, flushes the eye. So what? It's good.
Yeah. Okay.
That doesn't mean it's not perfect. That doesn't mean it's perfect. That means you've done a great job at this level.
Yeah.
That's what you have to do. Do it. Perfect.
Yeah. That was going to be my next question on the sheet, was how do you handle endo failure, you know?
Sarah, how do you handle endo failures? It depends on the failure.
Of course. Can you give an example of a failure?
Broken instrument.
Okay, and how would you go about that? I know we learned about it. Like
broken instrument where you actually break some of the files or needles inside the tooth, and and by the way, it's completely fine, and it happens to everybody. It happened to me 1 week ago, actually, last week.
You broke a file?
Yeah, I broke a file.
Okay.
But like the canal I had was too tight and calcified.
Oh, was it curved or no?
A bit, yeah.
That's crazy.
So there was a curvature.
Yeah.
And it was very tight canals. I did everything I can, but خلاص, it breaks. Sometimes it happens. So broken instrument, it happens, and it's very normal. And how do we deal with that? صراحة, there are so many words. There's so many blah 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 blah. There is so many ways. Retrieval of files where we can actually remove it and خلاص, continue the treatment. Where we can bypass it, where, like, for example, the file is here, where you can actually bypass it and move around it and then get to the apex. That's the two main treatment plans for broken instrument, for example. But طبعا it depends where it broke: apical part, middle, cervical part, the file, the size.
Yeah.
There are so many ways. Retreatments, failures. صراحة, I would consider this as a failure, where مثلا, for example, I did a root canal treatment and the patient came up to me after 6 months where he's still in pain.
Yeah.
So that's a failure, where we do have retreatments, where we have to take out the filling materials and redo it again.
Yeah.
So, and that happens.
To end it off, we just want to take away a message from you on advice to students who are pursuing endo. يعني ناس هلا خلاص they're deciding, they're making that decision إنه I want to go into endo. شو إشي مهم لازم يحطه في باله or to consider or to have in mind قبل ما خلاص I make the final decision إنه أنا بدي endo. Camera is yours. It's you and the people.
شوف, هحكي ميكس عربي وإنجليزي or sorry.
No, it's okay.
المهم, انا اندو صراحه بالنسبه إلي يعني صار حياتي زي ما بتحكي. it's my life. Endo is my life actually right now.
Yeah.
That's what I'm doing, that's what I'm studying. I'm 100% focused on endo. So how do you choose that you want endo? ايش بدك تكون؟ صراحه you need to بدك تكون طويل بال، بدك تكون صبور، بدك تكون في عندك شغف، بدك يكون عندك تنام انت ميت تعبان ميت، تصحى ثاني يوم انت الشغف والطموح واصل عندك فل مره ثانيه. ما عندك هذا الاشي صعب تكمل بالاندو، لانه اندو بحكي مش اشي سهل. يعني انت you deal with this case مش معناته you dealt with a case you finished it within 30 minutes a single visit مش عارف شو. the next day you might have a case that requires 4 5 6 visits لانه you don't have enough experience in that case or in that anatomical variation. So it takes time. صبور طويل بال، صبور طويل بال. بدك صراحة تسوي weird thing، تلعب جيم. Gym is important for other people.
For sure.
صراحة I started having back pain. والله I started having, I think you guys noticed me when I talk about my back, my lower back, and it's very common in endo. صراحة I stopped gym for 2 months right now because I was too busy, but now I'm getting back to the gym. Sports, walking, running, keeping your back straight. I think you guys notice. Yeah, muscle. بس mainly if you want endo متحير بالendo come to me. I promise you حقنعك بالendo. I will convince you to study endo. Endo is the best thing. وصراحة شوف endo مش endo. It all goes back to their origin. It all goes back to أصلك أنت. Why did you choose dentistry in the beginning? Like why did you choose dentistry شهير? By luck. Why did you choose dentistry?
Because I fell in love with it because of جوز خالتي.
Exactly. I chose dentistry because I want to relieve people from their pain. يعني see, I love helping people. I don't want to be like too dramatic right now. But I love helping people. I love relieving pain from people. So I chose dentistry for that. And I don't want to go into medicine and medical career high. It's just a long time. I'm going to waste my time. I'm going to waste my age.
My life.
Yeah, I'm going to waste my life doing that. So no, that's why I chose dentistry. And I had a passion for teeth and how they're developing and everything, blah, 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 blah. So people usually come to clinic when they are in pain. And I want to relieve people from pain. How do you relieve people from pain? 2 ways, either endo or extractions. And 70, 60, 80% of the cases they're endo. So yeah, that's what I want to do. So not getting to the working length is very normal.
Okay.
Trust me, believe me, it's very normal. Not seeing the canals, not seeing the access cavity, perforating. عادي, very normal. We've all had this. I have perforated a tooth once. It was lower 6, lower molar. صراحة أنا من النوع اللي I don't يعني ما حستحي أو أخجل أو ما أحكي about my failures أو about things I've done لأنه إحنا we're learning in the end and people come here and they sign high. صراحة it was one of the patients. He was a young age صراحة. He became a friend to me, Rami. Yeah, he became a close friend.
Nice.
Yeah, he wanted to do root canal treatment. صراحة I tried to do the access cavity. I perforated the tooth, which went for extractions, but I extracted the tooth as well. You know, I had my apex locator, my endo instruments, and then blah.
All the instruments.
Mucopreocial elevators, forceps, and I extracted the tooth.
That's what we call maximum invasive.
Yeah, maximum invasive. So it happens, guys. والله عادي. يعني don't regret it. عادي, feel bad a bit. It's gonna like be in here. بس خلاص, you learn something. That's life. You do mistakes, you learn from them. Next time, inshallah, hopefully, I'm not gonna do the same mistake again.
Yeah.
It's if you wanna do endo, if you're considering endo, come to me. Wallahi, I will convince you to study endo. Endo is nice. Endo is a
Links
very
to Musa
wide.
here if you want to contact him.
Yeah. No, it's great hearing that because it's like some people could be interested but they're too scared or this and that.
No, wallah. Be open, talk. If you want to ask me questions, talk to me about it. If you want to come to the master's clinic and see the different
technologies.
Different technologies, different machines, weird stuff. Come, see.
His handles, you can contact him. There you go. That's awesome. That's perfect. That's a good resource for everyone.
Yeah. صراحة فأنا my last advice, I think that was your question. ولا for endo.
It was your okay. So endo advice is done. Your general advice to students.
general advices. Going into university?
Going through university.
Going through university.
Someone who's in first, second, third, fourth.
صراحة guys, والله العظيم, don't panic. Don't stress out over exams. Don't stress out over... he keeps doing that. Don't stress out over anything. Wallahi, it's a matter of time where you're gonna actually graduate and be in my position. And inshallah, maybe higher than me. Inshallah. It all comes with time. And I've realized that صراحة from the place I'm right now and dealing with the younger students or dealing with the younger doctors, we've all been to the same circle. Wallahi guys, it's a loop where you go into the same thing. What you have been through or what you're feeling right now or what you're doing right now, ex-doctors, ex-students were in the same exact position. So take it easy, enjoy your life, enjoy uni life. Believe me, you're gonna regret not enjoying these times.
Yeah.
I've lived with my batch for 6 years and they're all gone now. Literally, they're all gone. I don't see anyone from my batch. Okay, I had my good and bad moments with them, but at some point where you're gonna actually miss having them around. It's hard, like studying in a group and then all of a sudden you study alone. saw me studying alone and doing this. I was like, I miss عبد السلام دحوم my friends يعني بشكل عام. فيصل طبعا. لا صورنا مش
اوكي. It's gonna be a lot of editing.
صورنا مش اوكي بس ف enjoy, study. بسيسو صراحة talked about it earlier. Have time management والله. Study, enjoy, do this, do that, all at the same pace. يعني don't panic. Enjoy hard cases in clinic, enjoy easy cases in clinic, enjoy writing assignments.
It's fun, man. It's better than doing exams.
No,
it's so much better.
No, I have like 3 assignments. Do them, please.
I would love to do my exams, man.
Yeah, exams. No. Look, for exams, والله أنا من الناس على فكرة جماعة إنه أنا قبل الإكزام ساعة, like before an exam by 1 hour I stop studying. Wallahi, I completely stop studying. I go out for a drive, I listen to music, I drink coffee or whatever, and I just enjoy. Wallah. Do what you have to do, study, stay up to date. صراحة attending lectures is important. Wallahi, attending. Wallah, believe me guys, attending lectures is more important than actually studying alone. صراحة, that's what I believe. No, I used to attend lectures at all, like every time, but I didn't study as much. Alhamdulillah. I'm here right now.
Yeah, took the 4th spot for endo.
Yeah.
And
my GPA is not 3.94.
Never will be. Neither will I ever get
not either 3.8 say so, but صراحة don't worry too much about GPA. عادي. You get C's, you get D's, so what? يعني you're not a perfect human being. يعني صراحة الكمال لله. بس
perfect as 3.94. No one can be like that.
الكمال لله بشكل عام. أنا مالي دخل بس والله walk through it, enjoy every bit of it, enjoy everything, enjoy literally every small detail of it. Then you're gonna remember it.
Yeah. Oh, I have something in my eye. Sorry. No, that's great. Now I'm crying too, see?
Okay,
it's so funny that you did that, you know? Anytime you see Sisa doing this, he's stressing about something.
Yeah.
He's just stressed.
Yeah, the last week, I don't know, we were studying in Tim Hortons.
Yeah.
Tim Hortons? Where were you studying?
أيوة.
Tim Hortons, yeah, we're studying in Tim Hortons. Bro, he like...
Yeah.
Do you know, it reaches a point where my shirt is full of...
Yeah, full of fur and... Yeah, look, it happens to be sometimes, but like you're overdoing it, you know what I mean? Like, don't stress. Wallah, okay, so what? You got 35, you got 25 out of 30, so what? You got 15 out of 30. Khalas.
You know, one of the doctors one time in class was like, I'm not going to say his name, but he saw Sisa doing it and he's like, students don't come to university to do this.
لا والله not worth it. Wallah, not worth it.
And then Sisa looked back at me and he's like,
عادي. Focus. Do what you have to do. Stick to your plans. أنا صراحة I believe in a sentence. Everything will fall into the right place at the right time. خلاص, don't think about, you're in 3rd year, don't think, you just started clinic, you finished your 1st semester in clinic, you're going to 4th year, and he's worrying about what he's gonna do in masters. Don't.
Yeah.
Just live the moment you're living right now. Live it, do it, believe it, move on.
That's
I think,
perfect.
ما
Yeah.
بعرف, I think
That's like amazing to end this episode on.
alhamdulillah, and that's what I believe in, at least.
Yeah, that's good.
Alhamdulillah.
I would personally, me and Siso, we would like to thank you for
لا لا
coming
والله,
on the
thank
show.
you guys, والله.
You were our first, like, we were like Musa first, no matter
Alhamdulillah,
what,
alhamdulillah.
because it's just amazing. It's
لا
super
لا,
nice
thank
to
you,
have you as
والله
a
والله,
friend.
it's an honor والله to
thank
be
you.
here in the show. وإن شاء الله this show يعني
Inshallah.
You in it.
Yeah.
إن شاء الله, يا رب. And good luck, guys.
Thank you so much.
Study well for your exams.
Thank you. Oh, you guys too.
Yeah,
Them
you guys
too.
too.
Yes.
Please.
We would like to thank you all for watching today's episode. We hope you learned something and enjoyed. And the next episode is going to be amazing as well. So stay tuned. The episodes are just hopefully slowly getting better, as everyone's been telling us. And
Yes.
we're for sure going to have him again at some
Inshallah.
point, because you're
Yeah.
only in your first semester. So we definitely want more advice later on when you get into your second year. And
Inshallah,
so
ya
on.
Inshallah, ya
So
Rab.
yeah, thank you very much. And take care.
Bye.
Bye.